70% of people are overweight. And why are we overweight? Because we live in an environment now where we are surrounded by food. Evolutionary or primitive, we went out and hunted. You are surrounded by what we call an exogenic or a calorie-filled environment. So you've got this primitive brain, and your primitive brain is telling you to go out and eat.
You're listening to Biohacking with Brittany. I'm Brittany Ford, holistic nutritionist, wellness expert, and mama. This podcast is your space to explore the science, strategies, and soul of optimizing your health through every stage of life. Let's get into it. Oh, welcome back to the show. I'm thrilled that you're listening, and I'm happy that you're here, all of you. And I just want to say shout out to all of the people who are in my DMs, all of the moms, honestly, all of the women, but also all of the moms. I just get a lot of DMs from women who are going through a lot right now and are trying to optimize their health, but are also carrying so much. You know, they're carrying the weight of their family and their partner and maybe their career. And it's been an interesting week where I've been having some really deep conversations in my DMs lately. And I really, really value that a lot, actually. So if you're one of those women listening, and I think you know who you are, thanks for listening and thanks for being here and being a part of the community. I'm always happy to answer any of your health questions and just tell you how it's been for me as well and give you my 2 cents. And speaking of, women in community, I'm launching a online community for women. More specifically, I'm launching a online community for moms. And this is a place where you are going to be able to have access to the top experts in the world on topics that you actually want to know about. And things like everything I kind of talk about on this podcast: health, wellness, biohacking, longevity, but more specifically, things that are very relatable for moms who are listening. So things like maybe postpartum depression or anxiety, or intimacy after having kids, or libido. How do we increase our libido and feel good sexually about ourselves again? Or postpartum hair loss, or, how do I not become burnt out as a mom? And all of these different things, all of these complex topics. And I'm creating a space where we can all come together and hang out. And it's going to be great. You're going to get access to the top experts. And when I say access, you get to submit your questions, and we're going to do live off the record podcasts with them. And you get to actually just join our call and see the expert answer live. So that's coming, and I'm so excited. And that's just one component of it, by the way, guys. We're going to be doing live Q&A calls with myself. And we are going to be doing mama masterminds, where I'm going to be doing a deep dive into different protocols where I can just give you information and help you. Like, for example, this week I posted something about my inflammation markers being low. Finally, 13 months postpartum, and my CRP is finally dropped. And I got a lot of women responding, being like, how did you lower your inflammation? And so that's going to be one of my protocols that I'm going to put out. We're going to do a little mama mastermind call about it. And I'm just creating a space where moms can optimize their health, their mental, physical, and emotional well-being, and for their families. And yeah, it's going to be really cool. So stay tuned for that, launching really soon. Really chill, casual place, but also a place where it's uncensored. And I don't know if I like that word, but I'm going to use it because we're going to talk about things that you don't really get to find online very easily. And I'm sure you can imagine what some of those topics might be. Peptides, microdosing mushrooms, vaccines, whatever else might be bleeped out of this episode. So that is also part of it, is let's find the healthiest answers for our families and us. And let's be able to talk about it online without being censored. So stay tuned for that. And by the way, that's called Where Mamas Optimize. That is my online community, and it's launching, I don't know. Could be this week, could be next week. This is a real fast turnaround, and I'm really excited about it. And it's also you get access to my complete baby steps fertility preconception course, my 90-day protocol that I got pregnant with on the first time. I'm including all of that in there. And I'm building a non-toxic baby registry guide right now as well. So enough about what I'm building. I don't even know how I got on that topic, but that is what I'm kind of like doing during nap time and when I have childcare right now. And today's episode actually kind of goes in line with that. I got to sit down with Sarah Kennedy, who is the CEO and founder of Calocurb. Now, this is a company that's pioneering natural appetite control solutions. So cool. She was amazing to talk to, but this company is epic. Like I was floored by them and so impressed. So it is a 100% natural appetite control supplement, and it is developed in New Zealand over 14 years ago. There's been $30 million invested into this by the New Zealand government. Okay. And we talk all about what this means. How does this compare to GL1P antagonists and things like Ozempic or Wegovy, these injections that we're seeing people do? And I am obsessed with this. I think Calocurb is a much safer, more natural solution to appetite control than using something like that. My mom is using it right now, which I love, and she has definitely noticed a difference. And we talk all about the benefits of it and how it actually works and how it doesn't suppress your appetite, around the clock. It actually is in rhythm with your appetite. So you take it before morning, like before breakfast, you take it before nighttime, before you have dinner, and it suppresses your appetite during those windows. And we talk a lot about that and even the gut hormone signaling that can happen with that in relation to appetite and metabolism. So Sarah is a wealth of knowledge. It was really beautiful to be able to sit down and talk with her. I love New Zealand. Oh my gosh. I lived there for about 9 months a few years ago. So we also got to talk about that. But if you are somebody who is looking to manage your weight in a very natural, gentle way without strict dieting or yo-yo dieting or using injections or anything synthetic, this is for you. This is what I would do and what I would use 100% if that was something that I was looking for. So definitely check out Calocurb. That is spelled Calocurb. You can use my link and my discount code to be able to save. I will link that in the show notes for you and on my website so that you can find it super easily. I know you guys are super into this right now, and I would be as well. And enjoy this episode. A shout out before we start to Spermidine Life. Man, every time I post about Spermidine, you guys just eat it up. And Spermidine is one of the coolest anti-aging longevity supplements that is out there. Spermidine is something that actually already exists in our body. And so when we start to age around 30 or so, our levels start to decline, and we can actually increase those levels by taking Spermidine. And it works by activating the autophagy process, which is basically cellular renewal. We want to clean up the old cells, bring in the new ones. And that is what Spermidine helps you do. This is a staple. And you know what? Just speaking of postpartum hair loss, if you're somebody who's dealing with that or really brittle nails, one of the first signs that most people note from taking Spermidine is actually an increase in hair growth and thickness and thicker, stronger, and healthier nails. So don't have to ask me twice. What amazing benefits. I want that. So definitely check that out if you are interested. I will link it in the show notes. Use my discount code BiohackingBrittany to save, and it's on my website as well, biohackingbrittany.com. And I'm so excited that my retreat has launched, you guys. Optimize Her is a 5-night Costa Rica luxury retreat for the woman who is looking to get away and honestly have a life reset. It's live now. Several spots have been taken. I'm not kidding. And it's August and it's in March. So if you are thinking about this and you're like, man, I really want to go. Should I go? I don't know. What about this? What about that? Whatever your excuses might be, this is your sign to go and book your spot immediately before it's full. If you hear this and you're like, yeah, I really want to do it, what would happen if it completely booked up and filled and you had buyer's remorse? or not buyer's remorse. That's the wrong one. If you had FOMO, like fear of missing out, right? Like you don't want to miss this opportunity. And I don't want you to miss this opportunity. Once it's full, it's full. I can't actually open any more spots or any more space. So I would really suggest, if this is like something that you keep kind of going back to in your brain of like, oh yeah, Brittany's doing that retreat and I really want to go. And it's so cool. They're doing IV therapy and a cacao ceremony and yoga and functional medicine. And it's in a crystal mountain. Like if that's what you're thinking about, now's your time to book. Please secure and save your spot before someone else takes it. All right. Enjoy this episode with Sarah. Thank you for listening, and I will catch you soon for another one. Sarah Kennedy, the CEO of Calocurb. Welcome. I would love to start off with, first of all, obviously I understand what your supplement does, Calocurb, but I would love to understand the thought behind this. Take us back to the beginning. Why did this even seem like something you wanted to get involved in the first place?
Sure. Hey, it's a good story. It's a 15-year story. In 2010, a group of very talented New Zealand scientists who worked for the government, just a background to that, just about all primary research is funded by the government. And they had a hypothesis that they would find a plant-based extract that suppressed appetite. And they did that for a couple of reasons. Historical, with people in the Highlands of Scotland used to chew very, very bitter heath peas to suppress appetite. And in fact, they say Charles II used to give it to his mistresses to lose weight. Now, whether that's true or not, I don't know. And then tribesmen in the Kalahari Desert chew very, very bitter cactus before they go hunting to suppress appetite. So they had, and then there'd been some recent work in rats. So they put in for a grant. It was called Foods for Appetite Control, and they got a $20 million grant back to investigate that. And they did some incredible work, but I'll summarize it quite quickly for you. The first thing they did was took 300 biopsies from the human gastrointestinal tract. So right down from the stomach, right down from the colon. And then they had a look at all of those biopsies, and proved that we had bitter taste receptors right down through our gut. So not only do we have them on our tongue, we have them right down through our gut. And there's a reason for that, and I'll get into the reason. But they then showed these bitter taste receptors, which are called TAS2R. Don't ask me the long name, but I know they're called TAS2R. When stimulated, release hormones. So what is the reason for them in our gastrointestinal tract? Well, it's actually evolutionary. So we have 25 taste receptors on our tongue. So if we eat something bitter, we spit it out, because the body says bitter could be toxic, so it spits it out. If it goes down to your stomach, you're going to do one of two things. You're either going to feel nauseated and vomit it up, or you're going to release ghrelin, which is a hunger hormone, which is then going to stimulate you to eat more. So you're trying to dissipate what this toxin is. And thirdly, if it goes past your stomach, say it's a covered seed or a covered berry, into your upper duodenum or into your upper gut, it's going to stimulate the release of, firstly, CCK, and then GLP-1, and then PYY. So these appetite stimulating, these appetite reducing, suppressing hormones. And the reason for that was to say, go up to your brain and say, hey, don't eat anymore. You've eaten, this could be toxic. Now, so evolutionary to stop us eating toxic or bitter plants. But interesting enough, plants sort of evolved at the same time as humans, because if you think about it, let's say an apple tree. An apple is very, very nice and sweet, right? So what the apple tree wants you to do is eat the apple, but the leaves are very, very bitter. So the apple tree doesn't want you to eat them. So this is how humans evolved, and plants evolved alongside them. So yes, they proved that we had these 25 bitter taste receptors right down through our gastrointestinal tract. And when stimulated, they release different hormones. So this was your gut-brain axis, or part of your gut-brain axis. They then built this high throughput enteroendocrine model to test. They test over 1,000 different extracts, and literally only 2 worked. One was an extract from potatoes, which was great, a potato oxalate, which was great. But the thing is, it's poisonous, so you'd be thin but dead. The second one, the second one was a variety of hops. So hops being the bittering agents of beer. So they then, and then because they were plant and food research, and they'd developed most of the hop varieties in New Zealand, they then tested 50 more hop varieties to get the one they called the Eureka, which released the most amount of hormones when these little bitter taste receptors were stimulated. So this all goes on. So they get it. They say, yep, we can know we've got these bitter taste receptors. We know they're right down through our gut. We know if they're stimulated, they'll release that. We know one thing that'll stimulate them. And if you think about it, of course, only one, it's going to be very rare what stimulates them, because if everything bitter stimulated them, we wouldn't eat. So they know that. So they then took it into their first human clinical. And that was in around about 2015, 2016. And wonderful clinical trial. They gave, 30 men, they gave Calocurb an hour before an eat to your full lunch and an eat to your full snack. And then they were all cannulated so they could measure their bloods. And they showed that we increased CCK, so cholecystokinin, GLP-1 and PYY by 600%. So, and that's really important, because to have any behavioral change, you have to increase them over 400%. So everything that you read, and it goes, we help GLP-1, go and ask the question, how much do you help it by? Firstly, most of them have never measured it, because it is very hard to measure and very expensive. And secondly, one that's quite a well-known name, and I won't tell you, increases it by 65%. Now that's wonderful, but it's going to do nothing. It might slightly drop the blood glucose, but it won't do anything behaviourally. So they got this massive spike in these appetite-suppressing hormones, but they also got an 18% reduction in calorie intake from placebo versus dose.
Picture this. You wake up in the Costa Rican jungle, sunlight streaming through the trees, fresh tropical air, and your day begins with yoga, nourishing food, and luxury spa rituals designed to restore every part of you. This is Optimize Her, my 5-night luxury women's retreat where biohacking meets deep feminine restoration. Together, we'll reset your body, upgrade your health, and enhance your longevity with workshops, sound healing, cacao ceremonies, and so much more. And here's the catch. Spots are extremely limited. A few have already been taken in the first 24 hours, and once all 12 are gone, they're gone for good. So if you've been waiting for the sign to finally say yes to yourself, this is it. Go to biohackingbrittany.com right now to claim your spot before it's too late. Optimize Her is waiting for you.
So this was the mechanism of action. Now I'm going to give you a comparison to that. A semaglutide, which is your Wegovy and Ozempic, you on average reduce your calorie intake by around about 24%. We're 18%. So, and we're working with the body, we're super stimulating your natural release of appetite suppressing hormones versus injecting in synthetic. So there's the difference. So roll that all up to 2017, and what they normally do is the government research, they go, we could have something that we could commercialize. How should we commercialize it? And that's when they approached me because of my background in the whole industry in nutraceuticals. And they said, what would you do with this? I said, but like the man that liked the company so much he bought it, I said, I think it's fabulous. I had never seen something with that much science in this bigger category that we could really own from source to shelf. So, I thought it was, so I said, I'd like it. So I think it's a bit more complicated than that. So
Yeah.
a little bit more complicated, but, I raised the money, I formed a team, and we launched Calocurb, and we launched in 2018. But
Wow.
remember, in 2018, uh, Wegovy had not been approved by the FDA. So there was so little knowledge about whole of weight management and
Yeah.
etiology. So we did well, but it was kind of like people were like, "You're doing what? You're stimulating hormones?" What, and like they didn't
Mhm.
understand it. Of course, fast forward to 2021, and we'd been locked down. We started to be locked down in COVID and everything like that. And Wegovy came on the market, and and Novo Nordisk spent $1 billion on advertising in 21, 22. They took out 239,000 doctors for lunch and dinner to educate them on the etiology of weight management. So suddenly,
Woo.
we could then say doctors had, or practitioners had, a lot better idea of what GLP-1 and what appetite suppressing hormones did in the body. So that's sort of a real encapsulation of
Mm.
15 years. We've just done, we have done 3 more human clinical trials. So we
Wow.
can say that we suppress hunger by 30%. We suppress craving by 40%, which is really important for females, and I can go into that. And we reduce calorie intake by 18%. Our 4th human clinical, which literally just finished in June, and was 150 patients, men and women, uh, treatment and non-treatment, over 6 months with a 3-month follow-up. So that's been analysed now, and we should have the results by October. And we're measuring weight, body composition, bloods, and a number
Mhm.
of other biomarkers. So yeah, that's 15 years.
Wow. That's incredible. I wanted to ask about the emergence of things like Wegovy and Ozempic coming on the scene because you guys were on the scene before them. And so everyone kind of knows now GLP-1s, and it's almost like household language now, like Ozempic, you can tell when people have been on Ozempic with their weight loss online and things like this. Um, has that propelled your company forward? Because now there's like a higher baseline of education, and so people are kind of looking for Ozempic alternatives that are more natural, or are you kind of like competing with them? I guess
No, look, it's
no.
been, as I said, I get down on my knees and pray to Novo Nordisk every day. They spent $1 billion,
Yeah.
well, more than $1 billion now, but on that 21, 22. Do you know, before that, what I'd call the etiology, or what causes weight and weight management and how it is, was very unknown, even within the practitioner space, that we
Yeah.
were actually, our body is dictated to, our appetite is actually in our hindbrain. Our appetite center is in our hindbrain. So it's very evolutionary. It's very in a primitive brain. And most people don't realize, if you reduce your calorie intake by 25%, your hunger will double over 4 months. And that's your hindbrain saying, go out there and hunt, because you could be going into a famine. So this whole thing that
Mhm.
people used to say it's willpower and exercise, is completely and
Mm.
utterly wrong. It is what you eat, but it's not your willpower, because your body is saying to you, go out there and hunt. So what happens is, you've got your little hindbrain here, and your hypothalamus there, your little hindbrain, and over top of that is your forebrain. And what happens is you're going, no, you don't need to eat that. You just hold back. You put stress, you put hormones, you put alcohol, you put lack of sleep, you put a number of things here. The little forebrain goes, whoop, and the hindbrain goes, come on, we're off to eat. And this is your evolution. This is your primitive brain. It keeps you alive. When I talked about hormones, fascinating. In a woman, in the woman's part of her menstrual cycle, in her luteal phase, she will eat up to 200, on average, 200 calories more a day, because her estrogen, I think it's her estrogen, it's her progesterone, one of them, I think it's progesterone, sorry, estrogen drops, her progesterone is saying, hey, eat more, you could be going to implant an egg.
Mm.
And so,
Yeah.
it is, once again, we think we're highly evolved. We are highly evolved, but we're still primitive mammals. So, yes, they educated that we have a gut-brain axis, that yes, things like these appetite-suppressing hormones. So you're right. They educated this, not only the consumer, but the wider practitioner base. You think of how often a practitioner would have said, it's exercise and diet and willpower, and how stigmatizing that was for people that have a super wired brain who just cannot, that hunger noise all the time. So amazing for that. And as you said, practitioners or consumers are using us in one of three ways. They're using us as an alternative if they can't take the side effects. Because let's not forget, while we stimulate GLP-1 at 600%, you're probably injecting in over 3,000%. Because remember, it's going down during the week. It's a 7-day course. So you're getting a half-life during that. So they're taking us the side effects, which are pretty tough. They can't afford it. They don't want to inject themselves, or they want something natural. A lot of people using us now at the same time because they can keep their dosage of their injectables down really low, usually at the lowest dose. So if it's a tirzepatide at 2.5 mils, so at the starting dose, so you're getting exogenous and you're getting endogenous. You're getting both a synthetic and you're stimulating your natural hormones, which is really important. And then the third one, which I always say is not an if, it's a must, is when you're coming off the injectables. Now, the reason being is what most people do not realize, but if you think about it, it's pretty obvious. If you're injecting yourself with a synthetic hormone, you've reduced your natural hormones down to almost zero. Almost zero. That's clinically proven. So this is why you get this incredible rebound hunger when you come off, because you've suppressed.
Yeah.
They've gone, hey, I'm off on holiday. I don't need to. I don't need to do anything. You're giving it to me. That's just like when you inject in any synthetic hormone. So absolutely, as you're titrating off, and as I say, it's not an if, it's a must. Otherwise, you are going to go into what I'd call long yo-yo dieting. And it's going to
Yeah.
be extremely hard to maintain that weight because your brain's saying to you, you go out and eat. You go out and eat.
Yeah. 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 Great points. I think about like myself right now, if I would be interested in taking something like this. And honestly, probably not, because first of all, I'm breastfeeding. So I want to make
Yeah.
that I'm getting enough calories to produce enough milk. Um, and then I also think about, and I'm sure you get this question of like, do we want to suppress our appetite? Because this is something that's natural, that flows throughout the day, and we want to be eating enough food and proper food for it, that I just worry about like the impact on metabolism and on my weight and my body and my hormones and my menstrual cycle. Like, how would that all play together as somebody who doesn't really actually need to lose weight?
Yeah. Well, look, I think then no, you probably don't need to. But
Mhm.
let's look at is it 70% of people are overweight. And why
Mhm.
are we overweight? Because we live in an environment now where we are surrounded by food. evolutionary or primitive, we went out and hunted. You are surrounded by what we call an exogenic or a calorie-filled environment. So you've got this primitive brain, and your primitive brain is telling you to go out and eat.
Mm-hmm.
Now, in evolutionary times, we feast and famined. We went out and ate a lot and then had times of not eating a lot. And this is what made us want to eat. But we are surrounded by calories all the time. So how do we help our primitive brain in a modern world? Now, our brain has not caught up, in the last, 50,000 years, because it takes millions and millions of years. So our vision, I suppose, is to modernize human consumption. So it is a helper. It is a helper, it is a tool in the toolkit. And why I think it's so important. I always laugh because I used to say, gin was mummy's little helper. Now I call it Calocurb because, not for mothers, but during, it just helps you during the day. And do you know what I love when you talked about that normal hormonal rhythm? When we look at the graphs, when we're measuring these hormones, we're measuring, so against placebo and against ours, all we're doing is super stimulating them. So we see the placebo at 300% when we give a meal. We see us at 600%. So you're working with the body. When you're injecting yourself, absolutely, you've got high GLP-1, 24 hours a day, 7 days a week. You don't need high GLP-1 when you're asleep.
Yeah.
But hey, if you need, and also, you think about it. I talked about women during their luteal phase. That they can eat up to 600 calories more a day. You think of women in perimenopause, estrogen has dropped, hunger has increased, metabolic rate has gone down. Why do you not use a tool that will just assist and work with the body?
Yeah. Yeah. Ever wish you could slow down aging at the cellular level? Well, turns out you can. Spermidine is a natural compound found in foods like wheat germ and natto, and that's been shown to trigger autophagy, your body's innate cellular renewal process. Think of it as like spring cleaning for your cells, supporting longevity, mitochondrial health, and even hormonal balance. I've been using Spermidine Life as part of my daily biohacking routine to support energy, skin health, and healthy aging from the inside out. It's the world's first clinically tested spermidine supplement made with pure, high-quality ingredients you can actually trust. Ready to upgrade your wellness and age with more vitality? Head to the link in my show notes or on my website and use my discount code BiohackingBrittany for a special discount. We love that because you deserve to feel your best at every single age. Yeah, no, I think it's brilliant. I think it makes a lot of sense. For specific people, I mean, it's like you said, though, 70% of people are overweight. That's alarming. That's scary. And, if we're just injecting ourselves with something that is like just suppressing the hormone 24/7, even while we're sleeping, that's not necessarily the answer. But then you see
Well, it's going to put you into long-term yo-yo dieting. So what it's going to do is, I've yet to meet, the drug companies say you're on it for life. I have yet to meet a patient or a practitioner who wants to keep their patients on for life. Because, it's a pharmaceutical. Look, absolutely, there's chronic obesity, absolutely, but there's an affordability. At $500-600 a month, there's an affordability issue for some people. So, and also, I think to your point, it takes away the cues of hunger. So, therefore, like when you smash hunger completely and you're like, I'm not hungry, we know a lot of things happen. You're not going to eat the right diet either. You're not teaching people or you're not trying to coach people to eat the right things. They're just going to eat a smaller amount of what they shouldn't eat. And usually what they can eat because of the nausea. So it'll be something really tasty and usually highly processed because it's easier to eat. What you want to do is work with people to actually begin to coach on what can be eaten versus what can't be eaten. So, higher protein meals, less processed, those types of things. So we always say Calocurb will help you make better decisions. Because, when you're hungry, as I told you, your hunger will double over 4 months when you're denying calories. And when you're hungry, you just about will do anything. And then you'll go into this cycle of purging, binging, hating food, this whole love-hate
Mm.
relationship.
Yeah. 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 I think that's smart. I think it makes a lot of sense. And it's definitely something that I could like see myself being interested in the future. Um, do you have women who take it while pregnant or breastfeeding? And I also just think as well, like you said, like back to the injections, like if women are injecting this and like having all the benefits and then they want a kid, do they, once they become pregnant, they obviously come off the injections? And then what does that mean for their hunger hormones and metabolism during pregnancy and then postpartum?
So, I think they're advised to stop the injection at least a month before.
Yeah.
With so you could titrate off with Calocurb, but of course, we will say not with pregnant women,
Yeah.
and the reason being is you can't do clinical trials on pregnant women.
Hmm.
What I would say, so we can't clinically say
Yeah.
that. But what I would say is, and I'm just going to say this, and it's midwife, well, it's an old wives' tale, that breastfeeding, they used to encourage women to drink very hoppy beer to
Oh,
relax and make them, read it. It's common
oh,
wives' tale or midwifery. So they drank very hoppy beer. They just said it made the milk flow. I just think it relaxed women more myself. But I have seen some clinicals done on women that have had non-alcoholic beer, and the beer does not get into the breast tissue. Sorry, the hops do not get into the breast
right,
tissue.
right.
So we have never clinically trialed it, so we would say no.
Hmm.
But we know that, as they're coming off breastfeeding, and they're wanting to, to help to slow down or to
Yeah,
move some of the baby weight, is a
yeah,
possibility. But we can never advise pregnant or breastfeeding
yeah,
for those
yeah,
reasons. Uh,
yeah,
Certainly, if you're coming off the injectable, you could titrate onto it for a while before getting pregnant.
yeah,
And of course, as I said, we have drunk beer for um, thousands of years. I just want to make sure that people don't think, oh, okay, beer's going to help me. Beer will not help you,
hmm,
unfortunately. Beer is the hops are what we call um, isomerized. So they've just been changed a bit when they've been cooked. We're unisomerized, so slightly different because we don't cook the hops.
yeah, yeah,
Just on hops, it is 100% natural. We grow them. Remember, hops didn't come to us. We didn't go to hops. Hops came to us because we tested 1,000 different
right,
plant-based extracts. So we grow them in New Zealand. You would remember the region is just across from Nelson, so just across from Wellington at the
hmm,
top of the South Island. So in a beautiful area of the South Island, we grow them there. We extract them using supercritical extraction, which removes all of the phytoestrogens, removes all the biological materials.
yeah,
So you're just left with the bittering of them, and then the hops are sent to the US, where they're manufactured in the US in a very large plant in South Carolina, and it uses patented capsules there.
right.
It's a patented capsule which allows us to put it into a sealed. So not only are we patented, the capsule is patented. And then it's manufactured, bottled, and labeled in the US as well.
Yeah, I love that. That's awesome. And yeah, it makes sense everything that you're saying. I mean, it would be nice if we could drink beer and lose weight if it were worked like that. I don't really like beer, but like a lot of people would benefit from that. Um, but I guess beer in itself, just the concentration is probably not even there for how much hops is in it
That's
versus your supplement.
Yeah,
Yeah.
that's exactly right. And because it's isomerized, it takes the bitterness out of it. You'll still get the flavoring, but you'll take the bitterness out of it.
Yeah.
Probably if you didn't isomerize it, no one would drink beer. So what our patented capsule does is you swallow it, it goes down through the stomach, and it releases in the upper gut. So just, we always say, take it on an empty stomach because you want it to get past the stomach with a glass of water. Take it an hour to an hour and a half before a main meal.
Amazing.
So for people to make it easier, we say, take it at about 10:30 in the morning with a, just to remember, you normally have a cup of coffee at about 10:30. Just take it then. It'll go down. You'll eat your lunch because remember, we're working with you. You just won't be able to eat as much.
Yeah.
You just eat less.
Yeah.
And then I usually say take it at about 3:30 in the afternoon, 4:00 in the afternoon. And once again, I tell you, it's brilliant for people that snack after dinner. So if people are snackers after dinner, and a lot of people are, like if take it an hour before dinner, remember it lasts for 4 to 6 hours. So take it like an hour before dinner. If you're going to eat dinner at 6, take it at 5. And if you're an after dinner muncher, sweet, savory, you'll just go, you know what? I don't need it. You will be full for longer and you won't, that craving will be going down. Yeah. So really helpful for that.
That's so interesting because my husband is a big snacker and he's quite fit, but he's aware of his like snacking tendencies. And it's exactly like you say, like we have a healthy dinner, we eat at home, protein, all the things. And then it's like an hour and a half later, kids are asleep and it's like, oh, let's have ice cream or like a bowl of cereal. Him and his bowls of cereal.
And of course, he's going to spike his blood glucose. He's eating all processed and then he goes to sleep. So, try him on this.
Okay.
I'll send him because the thing is, an hour before dinner, absolutely. And then just watch it. He just will be full.
Yeah.
It'll take away that craving.
Yeah.
So amazing. I'm more a morning person. So I tend to I don't snack after dinner, but then like during the morning, well, I actually intermittent fast. So I take mine at about 8:00 and then I'll eat it like 1 or something like that because it's stimulating it no matter when you take it. We just try and make it easy for people, like saying take an hour and a half before lunch and an hour and a half before dinner. But if I'm ever going to be tempted, it'll be in the morning when they bring those muffins out or they bring something like that out. And I'm like, ooh, that picks you up. So, you can always know when those hunger times are. So just when you feel them, I'll take mine in the afternoon or the evening if I'm going to eat late because I'm like, if I'm going to eat late, I'm going to be ravenous. And I don't want to get to a cocktail party and like, ooh, eat everything.
Yeah.
And undo all of that good work. So, yeah, I and of course I'm going to say it, but I take it every day.
Yeah. I'm curious, just like with your examples, could you take it as like a one-off? Like if there's a one-off event, like say if like and this is not the case, but say if I had issues with like binge eating and I was like, I knew I was going to like a wedding or like a open buffet, whatever, or going on a cruise, like something that's just outrageous with a lot of food. And I am like triggered in those moments. Could I just like have it as like this thing I take this one day and then never or only take it every now and then? Does that make sense?
Yeah, absolutely. And yes, you can, but just be aware we have an onboarding. So we have a week. Once you've taken it and you know how your body reacts, remember it's a biologically active product.
Right.
So we have 1 a day for 2 days, 2 a day for 2 days, and then up to the dose, which is 2 really small capsules an hour before a main meal. But once you've gone through that onboarding, you know how your body will react. So like 5% of people, between 5 and 10% of people with that super stimulation will get a laxative effect, so a softening of the stool. Now, that's really normal. We say to people, wow, that's good. It shows you that your gut-brain axis is really working. 90% of people get nothing. They're fine, and probably the top 5% might need to take 3. And we're all biologically different. And it really depends on those taste receptors because we're not all homogenous. We're not all the same people. Like everything, some will have more, some will have less. So that's why. But once you know what your dosage is, and it's usually going to be 2 capsules, you're absolutely fine. And so many people come in and out of it. Like,
Okay.
I'm going
Okay.
on holiday, or I'm going into a big holiday like Thanksgiving, and I
Yeah.
don't want to overeat. I don't want to overeat at Thanksgiving. So I'm going to use this to help me. I'm going to eat everything I want. I'm just not going to eat enough. I'm going on a cruise. I'm going on some. I use it all the time for traveling because
Mm.
traveling, I'm on planes. I'm in America and not Canada yet, but I'm in America 12 times a year.
Wow.
So you imagine how many plane trips, and I'm always traveling across America. And what am I surrounded by? I'm not surrounded by great food.
No.
And I've got time zone changes. I've
Mhm.
got, a lot of food that isn't great. So I use it for traveling all the time.
That's smart. Yeah, I used to, before I had my kid, I used to, like, intermittent fast when I would travel.
Yeah.
But then I ended up, like, intermittent fasting too much. It actually impacted my menstrual cycle. So I had to,
Oh,
like, take a step back because it was
yeah.
stressful for my body, and
Yeah.
I my weight was fine, like, I don't know, like, I was probably too thin, to be honest, and so I don't know if that's something that I would do again, but maybe in the future, this is something that I will take when I travel instead.
Oh, absolutely. You just eat less. I
Yeah.
mean, and it's sort of a subtle feeling. Like, you go to eat, you still be hungry, and you go to eat, and you just go. And I think it's because, well, I know we're telling your brain you're full. You know, when you eat and you've suddenly, like 45 minutes later, you go, "Oh, I'm full."
Yeah, totally.
Yeah, we're just doing that before. We're just telling your brain you're full
Yeah,
before that. So we're just
yeah,
giving you a bit of a head start.
yeah,
And remember, I said you eat on average 18% less calories. So,
yeah.
and I said women should use it in the luteals, or in, luteal, I say luteal, the PMS side of their cycle, when they
Mhm.
crave sweet things. All of it's not going to help the cramping or anything like that, but it is going to help that hunger.
Ah.
And, so really good for PMS. There's just so many times,
Yeah,
that you can come in and out and use it. And because you don't have to beat yourself up, "Oh, I've forgotten to take it." It's, as I said, it's 100% natural. It's got
yeah.
hops, a specific variety of hops, a vegetable oil, and a tiny amount of rosemary that acts as its preservative.
Hmm.
So, and it only acts on your gastrointestinal tract. So less than 1% is in your bloodstream. So it's not going to affect your liver. It's not going to affect your kidneys. It's not going to do anything. And it's degraded within 20 hours in your
Wow,
colon.
wow. So just to clarify, for women who are having a menstrual cycle, you think the second half of your cycle, you should take it. The first half before ovulation, you shouldn't take it at all.
You can take it. No, you can take it. It doesn't do any harm. But if you're
It's
coming in and out,
okay.
but I'm just saying that
Mhm.
PMS, when you're,
When
really
you have those
hungry,
cravings.
craving, yeah. But
Yeah,
if you're trying to manage weight, I'd take it all the way through.
yeah. And it
If you
won't
want to get,
impact your fertility and your menstrual cycle.
no, no.
Okay.
Remember, it acts on the
Yeah,
gastrointestinal tract,
yeah.
less than 1% in the blood. It is just acting on the gastrointestinal tract. So
Amazing.
really, yeah,
Yeah.
with that. So all the way through perimenopause, absolutely.
Mhm.
Menopause,
Yeah,
absolutely.
yeah.
But I've had so many guys on it too, and men do make me laugh because I say they're like, "Man takes pill, man not hungry, man doesn't eat." Where women, we do tend to overthink food a lot. It's like, if I
Mhm.
don't have breakfast now, I could get hungry then, and then I won't have a choice of what I'm going to eat. And what will I do? Well, that's me anyway. And so I bumped into someone in my apartment the other day in the lift, and he's like a big, tall, 6'7" man, and he's like, "Look at me, look at me." And I said, "Oh, Phil, how you look great." And he goes, "No, look at me." And I'm like, "Yeah, Phil." And he goes, "I've lost 11 kilograms." And I'm like, "Fantastic." And he goes, "That Calocurb, it really works, doesn't it?" And I'm like,
Wow.
"Of course it is. Of course it is. We've spent 30 million on research. Of course it works."
It
So
better work.
guys, yeah, that better work. So, and, we're still owned by the New Zealand government. I just
Wow,
have the license for it. So
cool.
all of our research is done with the government. But yeah, guys are really good on it.
Yeah, that's funny. Yeah.
They're just like, "Man takes pill, man not hungry, man doesn't eat." So,
Simple,
yeah, try
simple.
your husband that after dinner
I
snacking.
will.
Yeah.
I'm going to tonight. Yes. Um, I'm curious about the role of something like this for children. So we're seeing a lot of kids and teenagers overweight, obese, obviously not leading healthy lifestyles. There's so many issues as to what's causing that: screen time, lack of access to healthy food, activity, etc. Is this something that a child technically could take? Or are you legally not allowed to recommend it? What's the deal?
Well, we're science-led, so everything we say, we want like to have clinically proven. So we are doing some work in adolescents
Yeah.
because I think it's 1 in 3 now are overweight.
Yeah.
And, the stigma. And remember as well with adolescents, yes, they are surrounded by, not great food, but, remember they've got raging hormones happening as well. So, how I talked about hormones
Mhm.
and all those things, that's not going to help in eating as well, those raging hormones. So we're doing some trials in conjunction with some nutritionists and a pediatrician on adolescents. If you said, could they? Well, it's it's safe. It's 100% safe. Can I say, will it make any difference? No, because I haven't. Well, I know what it does in adults, and we are doing clinical work in
That's
adolescents.
awesome.
I think also important, as we talked about before, I think there's a lot of stigma
Yeah.
for people with children, having to inject themselves. And I think to your point, you want to be a tool, but you want to aid them in their diet as well. You can't
Mhm.
just give something that takes away your hunger and you're not training them on how to eat later on. That's
Yeah.
actually going to do no good at all.
Mm.
And the thing that worries me with nothing, I think wonderful that we understand more the whole cycle of weight or the etiology of weight management. But what worries me as well is that you are getting this 30 to 35% of muscle mass loss with these drugs. And so I'm very excited about our fourth human clinical because not only weight, we're measuring muscle, we're measuring body composition through DEXA. So I'm really
Oh, nice.
interested in that. Yeah.
Yeah.
So that will be,
Yeah.
but I can't tell you till November.
Yeah. Okay. Yeah, I think there's a fine line because I think it's a very good point that you can't just give this to a teenager as a quick fix, being like, take this and don't learn about lifestyle and nutrition and exercise and all these other things. Um, but it's hard though, because if you're obese in those years of your life, like it's compounding. Like that's so
Yes.
young. It's so young for that to be an issue.
Yes.
Like when you're a teenager, like your metabolism is supposed to be like,
Yeah.
you know, I like it was when I was a teenager, it was easy. What? I ate whatever. It didn't really matter. It didn't really matter as much anyway as it does now. And so it's very scary when I see and hear these statistics because I'm like, how is that 16-year-old going to be when she is 45? And this is all she's known.
They are the predisposition to be overweight when you're older is very, very high. I think
Yeah.
it's something like 80%. So you're absolutely high. And the other thing, which is also a concern for what they're learning is more, and I don't know enough about it, is little fat cells have memories.
Ah,
So yeah, these little, and there's some latest research, these little fat cells have memories of what they were. So they're like, and as I said to you, your hunger doubles when you reduce sugar. Your whole body is saying, do not reduce your calories. You could be going into famine. So that's why we have to help people and also coach them. We are a tool in the toolkit,
yeah.
and if you're telling your brain you're just full, you are not going to eat as much.
Yeah. Yeah. I love that. It's a very holistic approach, which I really appreciate. Yeah.
And as I said, you're working with your body, and I love looking at the
Mhm.
graphs when I look at the placebo versus the treated, and they're working almost in absolute sync. It's just that we're higher than the placebo.
Yeah. Yeah. Very cool. So cool. If anyone listening to this wants to connect with you and try Calocurb and order it, where can they go and how can they find you?
Sure. It's www.calocurb, that's CALOCURB, calocurb.com. And you just go in there and just do it. And then, all the information, all the clinical trials, everything is there.
Amazing. Well, thank you so much. This has been so interesting. I love what you guys are doing. Love that you're in New Zealand, obviously. I will put all of this in the show notes and on my website so everyone can find you easily. Thank you for your time. This has been great.
Thank you. It's been great talking with you. Great questions.